So health sector unions in the Northwest, as we said a short time ago, are calling for the CEO of the Mahikeng Provincial Hospital to reinstate suspended nurses there who put those newborn babies in cardboard boxes because of a lack of incubators. Let's get you a live update on the situation. Bring in our reporter, Refiloe Seboko. Refiloe, there's been a meeting going on there as part of efforts to get these nurses reinstated. Is there any update? Will they go back to work?
Let's get that update, Tembekile, from the Northwest Health MEC, Madoda Sambatha, to tell us how that engagement went with the representatives of health unions here in the province. Thank you so much, MEC, and welcome to Newzroom Afrika. You've just completed or concluded that engagement with the unions. What is the way forward from here?
Well, we had a very good cordial meeting with all the unions organizing in health. The meeting was about their views on the situations that had happened here, and also engaging me on other elements that they feel I was not briefed on. And as a result of that, we're going to do rounds together. But we have agreed that one, because the preliminary investigation is coming out tomorrow, as I said, I will receive it, study the report. On Wednesday, we will have a follow-up meeting. Which follow-up meeting must then give an action plan on what we are going to do with the situation and challenges facing Mahikeng Provincial Hospital as we speak. And in our meeting, we had agreed that we need to find a solution jointly. If you're talking about the problem of availability of space, already we have a task team that must look into that, but in the budget we already have additional 100 beds for Mahikeng Provincial Hospital. But on Wednesday, we'll explore all the possibilities. For instance, I said to them, one possibility must be looking into capacity of Muntsiwa Stud Clinic. Capacitate it to a level where it can take pressure away from Mahikeng Provincial Hospital. But secondly, look into available space of Refiloe Hospital, because some of their staff has moved to the new buildings. Whatever is available as space in Refiloe Provincial Hospital is then given over to Mahikeng Provincial Hospital as a way of relieving pressure. But we want to ensure that Mahikeng Provincial Hospital does function as a normal hospital.
Let me ask this, MEC. Unions are saying that it's not fair that nurses are being suspended or intention to suspend more nurses, more so because the issues of shortage of resources in particular have been reported to the department on numerous occasions.
Now we've agreed with them that precautionary suspension is not similar to suspension because you are facing a charge. And we have agreed that we will treat Department of Health employees similar. We've agreed that we will treat hospital employees similar. The issue is where they believe you should have suspended someone and not someone can never be dealt with by the MEC in public. People who must be suspended and not suspended must be dealt with letters that are given to them directly. So we will not open a public debate as to who is correctly and who should have not be suspended, who should have been suspended. But what I agreed with them is that there should never be a selective treatment to any employees of the Department of Health. As we speak, I still insist, there's no interest from the MEC to deal with doctors and nurses who successfully delivered babies. In fact, this issue of this baby is giving us another challenge of a community engagement and engagement of pregnant mothers in earlier stages of pregnancy until the day of delivery. Because what we see as a gap on the babies delivered, it's a lack of practical behavioral change of what a pregnant person must have. And that has to do with outreach programs.
We've seen the department sending 18 incubators following these reports that we see of babies being put in boxes. Are they enough, MEC, or are there still plans to bring in more incubators here at Refiloe, or rather Mahikeng Provincial Hospital?
There will never be enough because we don't know how many babies tomorrow. This issue of pregnancy and delivery, it's an issue that must be properly managed by management. If management has 60 cribs and baby warmers, it must stick to 60 that it has. If the number is going to increase, some elements must be done before so that there's no any instance where we had 47 cribs, 56 babies, and that nobody had an extra or nobody agreed to shift others to go and deliver elsewhere in the province. It must be an issue tight management of in and out of the hospital. Let management know who is admitted today and whether those people will have food tomorrow, and not be surprised tomorrow when people don't have food.
Thank you so much for your time. MEC Madoda Sambatha, he is the MEC of Health in the Northwest Province, Thembekile. They are just about to go on a walkabout. That meeting, one of the conclusions of the agreement was that they will go on a walkabout with unions, health unions. Nehawi is here, Denosa is here, Hospesa is also here, together with Nesingindaba. So they'll be making a work around here in Mahikeng Provincial Hospital to also see, you'll remember that Denosa earlier, together with Nehawi, indicated that this incident is just a drop of an iceberg, and also issue of the dire state of Mahikeng Provincial Hospital that they would like the ABC to address.
Refiloe, Seboko, thank you very much for that update in the Northwest.